नमस्ते शारदे देवी वीणा पुस्तकधारिणी विद्यारंभं करिष्यामि प्रसन्नां भव सर्वदा. हरि ओम. Good evening all of you. Thanks for joining this clinical orthopedics series, and today's joint is hip joint, one of the most neglected joints in your body. As a physician, as a clinician, we take this hip joint for option in our examination also. Anyway, I hope you all are very happy, healthy, and with great Deepavali.
Dr. Swati ma'am, please switch off your mic. Dr. Swati ma'am. Yes, sir. Sorry for the disturbance. Please continue.
Anyway, wish you belated happy Deepavali, and let us start with the subject. First of all, I would like to show you the journey of Orthoved. We started these type of series in 2017. I think it's 2016 we started first. It was one day workshop related to spine in toto. Then in October it was neology related to knee joint. I did my MD Sharir Rachana, and the subject of thesis was related to knee joint. So I worked on this particular subject. The third one was related to other joints, mainly shoulder, elbow, wrist, hip, ankle, and this was clinical orthopedics part 1, a day workshop. Then in 2019 we did clinical orthopedics part 2, and in that also we taught people about say bandages and everything related to joints. Then in 2019 we took a series on rheumatology, a whole day workshop related to rheumatology, mainly medicines, but basically an Ayurvedic physician's view is drug centric. A physician's view is every time it is disease centric, but an Ayurvedic physician's role view must be patient centric. That is what rheumatology teaches us. In neuromuscular disorders, mainly in case of Parkinson's and other disorders related to neuromuscular series, we took a day workshop in 2019. These are our courses. Panchakarma course, which is affiliated to MUHS Kshara Sutra course, and then rheumatology course. Now we are starting with dermatology and cancer care also. So let us start with, first of all, let us take some cases related to this joint. First, let us take some sports injuries related common conditions which are seen in our general practice. There are 6-7 disorders which are very commonly seen in our practice, and these are groin muscle strain, lateral hip pain, hip pointer, injury to lateral cutaneous nerve of thigh, hip dislocation, and pain around pubic symphysis mainly due to overuse. So these are some uh, main clinical conditions. And in all these clinical conditions, remember one thing, that Ayurveda works wonder. First, let us start with groin muscle strain. It is a very, very common condition. A strain of one of the groin muscles, be it the sartorius or say rectus femoris, part of rectus femoris rather, then say one of the adductors, iliopsoas, they tends to be a slow healing condition. Mainly athletes or marathon runners or high jumpers, they complaints of discomfort localized to the groin area, particularly when faster speed and higher knee lift are attempted. Remember one thing, if you are running very fast, just for say 100 meters or 200 meters, and when along with that, if immediate knee lift is there, then you get severe pain at the groin region. It may be a pinpoint pain or it may be diffused site. Tenderness is usually localized to the muscle involved. Placing the muscle under stress plus forced hip flexion, this will produce pain. So you have to put that muscle under stress, plus you have to forcefully flex the hip joint, then pain reproduces. And this particular clinical condition is known as groin muscle strain. So this is one of the commonest clinical condition, and this is related to Mausagata Vat according to Ayurveda, in which immediate relief with Vidya Karma. Afterwards, you can go for Parishek with Sariva Siddha Jal or Ushir Siddha Jal, or just you can just place Vaktra, Ardra, Vaktra Pravaran. That is, you have to just soak one cloth in Sariva Siddha Jal, and you have to place it at that particular tender point for at least 15 to 20 minutes daily. Otherwise, you can do Parishek also, but Guru Ardra Vaktra Pravaran is very simple to do, and it is very practical. It is very cheap also. It is not at all expensive thing, and easily it reduces inflammation with no time. Along with that, go for Vidya Karma, just 26 number needle of insulin needle. You have to just prick it at that particular tender point. Only these two things will reduce your pain immediately. Afterwards, you have to do some medication, some pichu like pindatel. You have to do that for at least for 5 to 10 days afterwards. But this will give result with no time. Along with that, remember one thing, you have to give that muscle stretching exercises. Prolonged stretching, you can easily learn this from your gym instructor also. Otherwise, there are some apps which can give you an insight about stretching of a particular muscle. So stretching is also very much important in this particular clinical condition. Another thing which is important is crepe bandage. Use of crepe bandage or taping of the upper thigh region to and you have to hold the hip in slight flexion position that will prevent complete extension of hip, which will immediately give him symptomatic relief and the player, the sports person, will get relieved from the pain. Uh, there are some physiotherapy related, machine related things also, like ultrasound or TENS also there it can be used. So what I mean to say is something very clear. First is Ardra Vaktra Pravaran with the help of Sariva Siddha Jal or Ushir Siddha Jal or Parishek is important. Along with that, please go ahead for Vidya Karma, which will relieve its pain temporarily, but immediately for some time. So, groin muscle strain is one of the simple clinical conditions which you can easily manage at your OPD level. Remember, first Guru Ardravaktra Pravaran plus or Parishek plus Vidya Karma, along with that some afterwards Pichu Dharan with the help of oil and some medication are important. Plus stretching of that particular muscle is very important. Second, second commonly seen clinical condition in sports injuries is lateral hip pain. Maybe it may be due to say weakness of quadratus lumborum or the abdominal muscles or the iliotibial tract. Iliotibial tract is a very important muscle band, strong muscle band, which may get pulled in many sports injuries. Uh, this will present with pain at the lateral thigh plus at iliac crest also. So, strain or weakness can be found in this case. Friction of iliotibial tract over greater trochanter is also one of the causes of lateral hip pain, and it is maybe it is associated with trochanteric bursa. But remember, my friends, many a times I have never diagnosed this case clinically. I have diagnosed this case with the help of MRI or ultrasound only, because that particular area is very fatty or very muscular. So, with the help of only palpation, I was unable to diagnose it correctly, but the pain was very consistent and very persistent. So I immediately, if a patient doesn't get relief in 7 to 21 days, then remember you have to do some other investigations, mainly say ultrasound or along with X-ray. X-ray is the first choice of investigation in case of any clinical orthopedic conditions. But in soft tissue disorders, you have to check for MRI also. So, trochanteric bursitis may be one of the causes, and it is because of, say, friction of iliotibial tract. Strain of, say, gluteus medius or piriformis may be there, or they have attachment at uh, near, say, greater trochanter. So that may be also one of the causes. Strain of gluteus medius is also one of the causes of lateral hip pain. So if the greater trochanteric bursitis is there, then please remember you have to do Agni Karma in that case. Along with that, you have to give some lap for bursitis. Bursitis, if it is infective, then the treatment will be absolutely different. It is very rare. Infective bursitis is very rare in nature, but if it is because of friction, then go ahead with lap chikitsa. Which lap to be used? Mainly, we use the Shanga lap along with Gruta, 1/5 part of Gruta plus the Shanga lap is used in these type of cases. Internally, we give Kaishor Gugul in this particular uh, Vyadhi condition. In acute, subacute, or chronic condition, Kaishor Gugul along with Rasasindur plays a very important role, plays a very effective important role in this. 62.5 milligram of Rasasindur plus 500 milligram of Kaishor Gugul works wonder in these type of cases. So, along with, say, Dashamula Kashai or along with Kokilaksha Kashai, you can give this combination. In case of, say, a strain or weakness of quadratus lumborum or abdominal muscle, you get pain at, say, along with iliac crest. At this particular point, when lateral hip pain is there, if the cause of lateral hip pain is strain or weakness of quadratus lumborum, then please remember, give Snehan Swedan for this. Which oil to use? Sahachar oil to use. In case of hip related region, remember one thing, go for Sahacharadi tel in all the Nirama clinical conditions. After that, you have to go for Patra Pottali Pindasved. That is Nirgundi Patra Pottali Pindasved or Eranda Patra Pottali Pindasved. That works wonder in these type of pains. If you get strain of gluteus medius or piriformis strain is there, then also go for a Snehan along with Patrapottali Pindasved. In case of strain is always related to muscle and sprain is always related to ligament. If it is strain, go for Snehan Swedan. If it is bursitis, go for Agni Karma and then Lepa Chikitsa. These are three reasons. The fourth reason of lateral hip pain is lower back dysfunction. It is also known as discogenic disease. It may be with radiation or referred pain in the hip area. If you find the problem is in the lumbar spine, that is known as LDS, lumbar disc syndrome, then please treat the main cause for hip pain, that is lumbar disc syndrome, and then only the patient will get relieved. In case of lumbar disc syndrome, I will go into details of LDS when we learn about um, lumbar disc or lumbar area. Lumbar area and cervical area are the last areas which will be talking in this series. So, and the fifth very important uh, diagnosis, which is commonly seen in lateral hip pain, is stress fracture of femur. Stress fracture of femur in uh, 70 plus age. Whenever a patient of 70 plus age comes to you with Vankshana Sandhi Shul, with hip pain, with unable to walk, with walk with limp, with unable to stand, unable to hold on both the limbs, then remember, my dear friends, first you go for X-ray. X-ray is the only fantastic diagnostic tool in this, and go for frog leg view also. It is also very important. If there is a stress fracture, or if there is a fracture of, say, femur at any level, say transcervical TC fracture or whatever, or intertrochanteric fracture, whichever fracture it is, and then you have to be very much careful. Lateral hip, in case of lateral hip pain, stress fracture, you should not miss. That is very important. So, appropriate strengthening and stretching exercises are very important in these type of clinical conditions in lateral hip pain. One thing you remember in lateral hip pain, that is leg length, and that is very important. You measure leg length, and say in case of, say, trochanteric bursitis or iliotibial friction, you have to immediately relieve patient's pain. That is very important. Third one is hip pointer, one of the most commonest clinical conditions in your practice. That is hip pointer. This is known as contusion to iliac crest. If you get contusion at the level of iliac crest, anterior superior iliac spine, or both, then hip pointer is a clinical condition that arrives. This contusion results in bleeding, then edema and pain. Sometimes, remember, very important, I have seen these type of cases, and you will also see these type of cases after your course gets over. Sometimes avulsion of a portion of muscle attached to the crest is there, may occur. Avulsion fracture may occur. Rarely there is fracture of crest is found. Athlete or a runner or a marathoner or a player, sports person, will be having difficulty walking normally, standing upright due to pain and complete muscle spasm. The area will be very tender to touch, and it is very important, very important. Remember, my dear friends, it is very important to rule out, to exclude intra-abdominal injuries in this clinical condition. First, please remember, if you are not a trained a physician in this particular area, then please call a surgeon for your help. He will exclude other mainly intra-abdominal injuries in these type of cases. In hip pointer, always remember, what not to do is very important for a physician. What to do is very commonly seen by a chemist also. A chemist can also give medicines, so that is not the problem. Problem is what not to give. So in case of these type of contusions, first, the most important is parisheko or ardhra vaktra pravaran. Parishek of Sariva Siddha Jal works as Rakta Prasadan in this type of cases. Like uh, ice, like say ice pack, this works. Sariva Siddha Jal, Parishek of Sariva Siddha Jal works. So you can apply ice also in case of painful painful area. So the symptoms will decrease if there is no fracture, and for a few days you have to do parishake, plus you have to do gentle stretching for a few days or for a few weeks. In case of oral medications, remember one thing, you have a great tool in case of contusion. Anywhere there is contusion, then please select a drug which is a fantastic one, and that is Rasa Sindur. Rasa Sindur along with Devdar. In acute conditions, Rasa Sindur along with Kaishor Gokul and Punarnava is to be used. In subacute conditions, we use Rasa Sindur along with Devdar. So, Rasa Sindur in contusion, immediately it reduces the swelling. It reduces the along with Parishek, it reduces the swelling within 3 to 5 days. And afterwards also you will never experience pain or swelling or any numbness type of thing after say 5-6 months also. So Rasa Sindur is a drug of choice in case of contusion. If there is fracture, it won't work. For fracture, you have to give some other procedures plus medicines, etc., etc. So this is say hip pointer. Injury to lateral cutaneous nerve of thigh. This is also one of the fantastic clinical conditions. In case of lateral, where is lateral cutaneous nerve of thigh situated? See, if you are wearing a trouser, if a physician, anybody who is listening, if he is a male person, if he is a male doctor, then he can stand up and just put your hand in your pocket, in your front pocket of your trouser. That particular pocket area, right or left, whichever you like to, in when you put your hand in your pocket, and you can feel the complete area which is there, which is overlapped by your hand. That particular area is supplied by lateral cutaneous nerve of thigh. So pocket, front pocket of your trouser, that particular area is supplied by lateral cutaneous nerve of thigh. This supplies proximal two-third of lateral thigh, this particular area, pocket area. And this is purely sensory in function. So, contusion to this nerve can result in impaired sensation over the thigh at laterally proximally. Muscle power is never affected in this case. It is purely sensory. You get numbness, you get tingling, you get burning. This type of problems you get. Recovery depends on degree of damage of nerve that is there. And uh, uh, one thing I would like to tell you, my sir gives this treatment and this works wonder. If obese patient gets this type of numbness, then they give a piece of sponge to place at the level of belt to that a particular patient. Inside the belt, they give a piece of sponge inside the belt area. The belt area presses that's subcutaneous nerve of thigh, lateral cutaneous nerve of thigh, because of which you get tingling. So the sponge will avoid that friction, try to avoid that friction, and this will work good. So occasionally this nerve becomes entrapped in scar tissue also, that produces constant pain in lateral, say, groin area or lateral thigh area also. And you have to, for that matter, if it is continuous burning or tingling, then you have to go for Jalavka Vacharan in this case. I have done this type of cases very successfully with the help of Jalavka Vacharan. If it is, if your Raktadushti is Ekamushti, then please apply Jalavka for that matter, and it works very effectively in injury to lateral cutaneous nerve of thigh. All the symptoms will get reduced with no time, and along with that, you can give Maharaj Prasarini capsule for this. In case of severe tingling numbness, please go for Bruhatvat Chintamani as a drug of choice along with Tapyadi Loho. In case of burning sensation at that particular area, please use Mautic Pishti as a drug of choice. If burning at any joint level or muscle level, along with, say, upset stomach or along with some GI problems, then please use Praval as a drug of choice along with your other medicines. So, in case of injury to lateral cutaneous nerve of thigh, please remember Mautic is a drug of choice for repairing that particular injured nerve. Dislocation of hip, very sensitive issue in general practice. A patient comes to you, and if you are not, see, you have to just identify the problem area. You have to just identify that this is hip dislocation, and then somebody else will do the treatment. But if you don't find that problem, then you may end up with spoiling the case, spoiling the patient. Uh, why I am telling you this? Because I have experienced this case. One of my friends only, he got with an accident. He people carried him to a hospital, and hip dislocation was uh, somehow, unfortunately, people didn't understand that, and people were treating his tibia, fractured tibia, and after few hours, or say after yes, after few hours, patient got worsened, and then the patient died also. So hip dislocation is very severe injury resulting from a considerable force which usually drives the hip backwards. Fracture may be associated with, many a times it is always associated with posterior dislocation. Anterior dislocation is very rare to occur. Posterior dislocation of shoulder is very rare. Anterior dislocation of shoulder is very common. In case of hip, posterior dislocation is uh, common. So, anterior dislocation, it rarely happens. Now, the sports person will not walk after this injury. Large prominence may be felt over greater trochanteric area with pain localized at the hip area. Affected foot will tend to rest on top of opposite foot. See, immediate apparent clinical diagnosis is very important. No attempt should be made to reduce the dislocation on the field. Very important, otherwise patient may land up in shock, and the patient, the sports person, should be go by stretcher only, and then say further things can be done. His or her reduction can be done under anesthesia only, and it will take months to resume to a daily activity for a sports person. See, very important thing in hip dislocation. Compression of sciatic nerve can result in impairment of foot function. In hip dislocation, first and the most and the commonest complication is compression of sciatic nerve. The second important complication of hip dislocation is, yes, it is very commonly seen by Ayurvedic people, is avascular necrosis of head of femur. It can occur up to 6 months after injury. So, if a patient gets high pressure or contusion at, say, trans cervical region, then he may land up with a vascular necrosis of head of femur. It is very common when femur remains unreduced for number of hours. So it is very much important to act immediately after dislocation. And osteoarthritis is one of the commonest complications in these cases. Osteoarthritis is bound to happen in hip joint thing, in hip joint. So these are some important clinical conditions related to sports injuries. The last and one of the main hip dislocation, please do not try at ground level. Please do not try at your OPD level. Please refer these type of cases. Please assist an orthopedic surgeon. Please get into touch with him, and always remember, training is one of the most important things in hip joint dislocation. So you need a surgical hand for this. So don't treat it at your OPD level. Last, one of the last important clinical condition is pain around pubic symphysis due to overuse. So maybe there are two, three important factors. One is adductor strain, then stress fracture of say inferior ramus. So many a times you must have seen these type of cases. Say stress fracture at inferior ramus level. You have seen it many a times. Mainly say above 70 years old female cases. They get this type of stress fracture. So these are two, three commonest conditions. The main symptoms in this case are pain and tenderness at symphysis pubis. It results in spasm of adductor muscles, and in severe cases, a patient may get a different type of gait also. So radiating pain down the inner aspect of thigh and up into lower abdomen can be felt in case of pain around pubic symphysis from overuse. For this particular thing, adductor strain or stress fracture of inferior ramus, you have to just give a patient avagaha, which is very effective in these type of cases. Plus, you have to for adductor strain give Samir Pannag as a painkiller along with say Yogaraj Gugul, and the second important thing is go for Rasonak Shirapak in this type of cases. Pain around pubic symphysis due to overuse, adductor strain or stress fracture of inferior ramus. Go for these things. After acute time passes away, then you think of giving capsule Ksheerabala tel or capsule Gandha tel along with Lakshadi Gugul for a longer period of time. How much time? Maximum, minimum 6 weeks. You have to give him this type of things. We use Basti in all these conditions. Which Basti? Sahachar Tel Matra Basti or Sahachar Tel Anuvasan Basti is used in these type of clinical conditions, which gives fantastic result in all pain around pubic symphysis due to overuse, maybe in case of stress fracture, and maybe in case of adductor strain also. So these are some very important clinical conditions in sports injuries. Strengthening exercises are also important in these type of clinical conditions. Now, there are some other factors also, some other clinical conditions also. Uh, Say we will take one or two today. The first is transient synovitis of hip. This is known as irritable hip also. Maybe it is related to childhood and is a short-lived affection of hip of the not known pathologies. Mainly, clinically, it is you can see pain, limp, and limitation of hip movements, restricted hip movements. Uh, there is no such known cause of this. Maybe injury and strain is the possibility or a trigger factor in case of transient synovitis hip, commonly known as irritable hip, traumatic synovitis. These are some names you can give it to him. And mild inflammation of synovial membrane is there in this case, which irritates because of say minor injuries. Maybe in case of viral infections, also in case of post viral arthropathies, also you get only transient synovitis hip or irritable hip. So you have to take history correctly, and with the help of Sandhiga Jwarahara Kwath, which is written by Acharya Bhav Prakash, you can easily get rid of these clinical conditions or these problems. It is seen mainly in boys below 10, and they complain of pain in groin and thigh, and you can notice it with the help of limb also. Um, Physical sign is limitation of say hip movements. Radiographs, X-rays don't show any alteration from normal. Now, it is very important only because this resembles clinically the earliest stage of tuberculous arthritis or Perthes disease. Perthes is avascular necrosis. X-ray have become apparent, and transient arthritis should be diagnosed only after hip has recovered, never while symptoms and signs are present. While the symptoms and sign last, the case should be uh, one of suspected tuberculous arthritis or Perthes. The child under 10, the child must be under observation, and if you diagnose it as transient synovitis, you have to give him full rest, complete bed rest, say for a few weeks, and you have to exclude tubercular arthritis, and then only you can treat it with the help of rest. So, transient synovitis is a googly diagnosis in case of general practice. Only with the help of rest, it decreases. So, you can easily treat these type of cases. Within 3 to 6 weeks, patient gets completely relieved. So it is important that you have to diagnose it correctly. And transient synovitis hip is to be differentiated by TB hip. So now there are pyogenic hip, RA, tuberculosis. I have to show you some X-rays regarding this. So it will take some time. So today we'll take a leave and let's meet tomorrow again for another clinical conditions, that is main is pyogenic hip, RA, tuberculosis of hip, Perthes disease, X-rays of Perthes disease, AVN, stages of avascular necrosis of femur, because it has unipolar blood supply. The most affected bone for avascular necrosis is head of femur. Then scaphoid is one of the bones which is very vulnerable for avascular necrosis. And third, the most important bone of shoulder, that is humerus, head of humerus, is always vulnerable for say avascular necrosis of that particular bone. Snapping hip is another one clinical condition. So let's meet tomorrow with newer things and with new different types of diagnosis. So thank you for being with us. Just a minute. Yes. If you have any questions, please ask me if you have any questions. If you don't have any questions, thanks for being with us, and we will definitely meet tomorrow late evening. That is around say 10 o'clock, 9:30 or 10 say 10 o'clock only, because I have to stop my OPD at 9:30, and then we can meet. Thank you all. There are no questions, so can I take your leave, Dr. Amit?
Yes, sir. Thank you, sir. On behalf of all delegates, thank you very much for this valuable session. Thank you, sir.
Thank you very much.